I've been a nurse for the last 22 years. I've worked in the Valley for the last 12 years. You used to play basketball at least 2 to 3 times a week. You know, I go to gym, I run, shuttle my kids from school to their sports, activities that they have. At work, I work pretty much like 7 days a week. That's including calls. I used to work 12-hour shift. Whenever I run, obviously it raises your heart rate up. Mine will just continue race, probably goes up to 160s or 170s, and it takes a while for it to come down. And then I really get short of breath or lightheaded. I knew I had irregular heartbeat, like palpitations, but I didn't know that I had AFib. I had my regular physical in October 2007, and just doing regular vital signs, my primary care physician said, "You have a regular heartbeat." He was feeling my radial pulse, and I said, "No, I don't." And he goes like, "Yes, you do." And I said, "No, I don't." And he goes, "Yes, you do." And then he said, "Let's put you on EKG," and then sure enough, it showed atrial fibrillation. Yeah, after I got diagnosed with atrial fibrillation, I was put on antiarrhythmic medications plus a beta blocker because I go on rapid heart rate. I've decided that I didn't want to stay on medications for a long time because of the side effects. I've researched online, and I found out that there's a couple of ways to deal with atrial fibrillation as far as ablation. You can do a radiofrequency ablation, or you can do a cryoablation. And just reading through it and the feedback from patients who had it done, and I know the success rate were really good, and so I said, you know, that's probably the best for me. But after I had the cryoablation in November of 2011 with the Medtronic, that's like day and night. Never had any, every now and then probably I'll get palpitation, but never had a rapid heart rate. Never felt lightheaded. I don't feel like I was going to pass out. I can do normal things. I can bend, I can kneel down, and I can stand up right away. I will not feel like I'm going to pass out. After the cryoablation, I have been AFib free for the last over a year now. It's going in a year and 6 months, I think, yeah, 7 months. I have not been on meds at all. I'm not on antiarrhythmics. I'm not on blood thinners, which is the best. I just take vitamins. That's it. I can do a lot of stuff. I can run again. I can lift weights. I can do any activities that I want, physical activities, and I'll be fine. I don't feel like I'm going to pass out or all of a sudden I have a rapid heart rate.